welcoming Joanne Corbett. Some of you may know her because she's been 33 years as the Executive Director of Elderly Services. And I wanted to ask any of you if you had a birthday this year.
Birthday this year?
This year.
Oh, okay. Well,
Have you had a birthday this year? Did you get any younger or did you get older?
Younger.
Joanne is going to tell us what we need to know about getting older and all the services within Addison County that we might be eligible for. And speaking for myself, I think I'm in the elderly category, so I'm going to listen carefully. And we welcome Joanne to tell us all she needs to tell us.
Okay, thank you. Yes, I know quite a few of you, and I actually retired a year and a half ago from being the Director of Elderly Services. I'm still working at Elderly Services as a social worker. And tonight I'm here with Amanda Payne, who's also another social worker at Elderly Services. So thank you for inviting us. And I and Amanda have passed out for you something to take home. You don't have to look at it now, but it does outline many aging services in Addison County. And we gave you our brochure about elderly services. And we also gave you a flyer about our counseling for elders and families of elders that we are expanding. And so those things you can take home and look at. Amanda's going to pass around a clipboard because we'd love to send our twice-a-year newsletter to you if you don't already get it. Many of you do. But if you don't get it and you're willing to receive it so you can keep us in mind, there's no cost for the newsletter, but we do need your address. And if you'd like to get an email about the lifelong learning courses that we offer, you can put your email next to it because I believe that brochure is just sent out by email. So there's headings that say address or email address, and so you can pass that around, and we gave you all a pen to take home to help remember us by as well. So I hope you have that so you can write. I wanted to begin by just talking about what elderly services can offer to you, what we're all about, and then, as Sandy said, touch on a few thoughts from positive psychology. Because when I say we're expanding our counseling and coaching programs, we're coming from a philosophy of positive psychology. And then I wanted to hear any questions or thoughts that you want to share. So, but while I'm talking, if you want to put up your hand, you don't have to wait till the end. If you have something to say, just wave at me and we can stop. I wanted to first ask, how many of you have heard of elderly services? Okay, so looked like all of you. And would a few of you be willing to tell me what you hear about elderly services?
I'd be happy to. I took my mother-in-law there many years ago, and she looked at the mind and started to go, and she needed some socialization. She said, I'm not going there. And I go, oh, okay. She ended up going there. It was wonderful.
So that's to Project Independence.
That's our most famous program. Yes?
To speak to the counseling I received when I went there, I would not have gotten through my husband's death without you people and the help and the advice that you would give me.
Okay, thank you.
And I can second that. I went and had counseling from Joanne for a husband with dementia, and probably could not have gotten through it without Joanne, so I appreciate that so much.
I'm on the board of directors and have been for many, many years. I know a lot about a very wonderful organization. Serves in lots of different ways.
Yes.
I'd like to give a recommendation too, because of your unique creativity in helping problem solve issues when families are in crisis.
These are all very nice compliments, thank you. Sometimes when I say, what do you hear about elderly services? Because I often ask that question when I'm talking to a group, people will say, oh, I think you have to be out of your mind to go there. So, meaning, I think, you know, there's a stereotype that you have to be losing your memory to be involved with our major program, Project Independence. And other people will say, I hear it costs a fortune to go there. So I was ready for, okay, what am I going to hear? And so all compliments are very nice. Thank you. Yes?
I can add in that when I consulted with you, when I suddenly was caring for an elder person, you just stopped everything and told me all the resources I needed to know, and it was free. Mm-hmm. I really appreciated that. Mm-hmm.
Okay.
Very, very helpful.
Thank you.
And for people who go there for the classes, they're very engaging and they're exciting, and it's a group who wants to be there and learn new things. So it's not just for being out of your mind. It's developing your mind.
Yes, Gary.
Yes, I was part of the first fundraising group that you put together for the original funding, and you had goals set then, and with Kathy being the treasurer and stuff, I know that you've met those goals and just done a wonderful job.
Thank you. Yes, you helped with the fundraising for our new building. Yeah. Well, so a lot of you already know something about elderly services, but I am going to, I wanted to also ask first, can you put up your hand if you've ever been in our building? Oh, okay. Again, a lot of people. All right. If you, so the new building is entered off Exchange Street, and if you haven't been there, it sits between Exchange Street and Route 7. And so when you go by Route 7, you can see it just above the Swift House, looking down in a little valley. So, well, anyway, nice to be with a familiar crowd. And so I wanted to first say that Project Independence, as I said, is our most well-known program. And the Project Independence actually has been around longer than elderly services. Project Independence was launched by the counseling service and home health as an experiment, and then when it succeeded, they created elderly services to continue to house it. But Project Independence is one of 10 elderly day programs, or elderly day center, or elderly daycare center in the Vermont, and 3,000 centers in the United States. And so we have about 100 members that come in during the course of a week. And the idea is that we call it Project Independence, but it's really to help you or your loved one if your independence is beginning to decline. So most of the people who come to Project Independence cannot drive anymore, and it's important to get them out of the house. More and more, the newspapers are full of information saying, are you aging? Are you an elder? Don't stay home too much. Keep getting out of the house. Social interaction will help you, your physical health, your mental health, and your memory. So one reason we want to get people out of the house is just for their own quality of life. If someone has had a stroke and they can't drive anymore, or diabetes has affected his vision and he can't drive anymore, or a grandmother has early Alzheimer's and can't drive anymore and doesn't really pursue the usual hobbies, then the day can be very long and kind of boring and kind of lonely, and adult children and grandchildren are worrying about such people. So we're trying to get people out and have a good time, a feeling of belonging, and something to give them structure to the week. If you don't have structure to your week, most of us don't have as good mental health. But we're also trying to get people out of the house because often there's someone else in the house who wants a break and wants some time alone and wants to be home alone without the responsibility of taking care of their husband, wife, or mother or father. So Project Independence is meant to give the elderly person a better life, and a better life to the elderly person's caregiver, whether that's a 75-year-old wife or husband, or a 50-year-old daughter, or a 25-year-old grandson. Sometimes the grandson has grandfather in the house, but the grandson goes to work and the grandfather keeps falling over and doesn't eat anything but candy bar for lunch. So we have this wonderful center open 5 days a week. We open at 7 in the morning and we close at 7 at night. And we have a light breakfast, and we have a big noon dinner, and we have a big supper, and we have our own cooks, and it's nice homemade food and delicious desserts. So a lot of people, if they want to tell you something, they'll say the food is really good. We also built, 20 years ago, a building that we built designed to capture sunshine and be full of natural light. And we filled it with cheerful colors of yellow walls and peach walls and white woodwork everywhere. And we have it painted every 3 months to keep it looking nice and fresh. And it has huge windows and beautiful wood floors. And so some people say, I feel like royalty when I come here. And that's part of what we call our therapeutic environment. At Project Independence, we want people's spirits to be lifted by being in a physical place of beauty, by having delicious food, and by being nice and warm. We keep it at 75 or 76 degrees, or nice and cool. In the summer, we have central air conditioning to keep people cool, because the papers are full now of, if you're an older person, you must have some cool air. You can't get too hot. I'm 71. We don't sweat effectively anymore. You actually have to have cool air, or you might need it because you have asthma. So we have beautiful temperatures, beautiful building, beautiful food, and most important, we have beautiful staff. So we try to hire employees who are kind and affectionate and entertaining. We hire a lot of people who can play music, who like to tell jokes and funny stories. So this is all in a medical elderly daycare center. So we also have nurses, and we're giving out pills all day and giving insulin injections and giving vitamin B12 injections, and we can change oxygen tanks. And some people, probably half of the people that come, we help them into the bathroom, we help them in the bathroom, and we help get around safely in and out of chairs. So it's very much a caretaking environment. And then we have a small number of people that we call purely social members who pay half price and help us take care of everybody else, and might even drive back and forth, but might be just relocated from New Jersey to live up here near their daughter and don't know a soul, and the husband dies and the wife is alone. And so some people come purely to be part of a social club where you see the same people day after day. And it's really like being at a summer camp or in school with other people that are looking to be friends and be cared for and have a wonderful feeling of belonging and affection. Anybody have any questions about Project Independence? This is 90% of what we do is run this center that's very complicated, actually, because of everybody's needs, and we've got to be in touch with their doctor and their family. And
What is your capacity of the number of guests you can have on a day?
We could have 60 to 65 for the, we have a 12-hour day. We're willing to have 60 to 65 at a time. And before the pandemic, we had 60 to 65 in the first half of the day, 7:30 to 2. And we had about 45 or 50 between 2 in the afternoon and 7 at night. And then we had to shut down for a year and a half. So in that year and a half, we lost to nursing home or dying half of our people. So we're building now. So now we're at about between 45 and 48 in the first half of the day right now, and between 20 and 35 in the second half of the day. So we can add a lot more people still.
Could you explain when you have a new person coming in that isn't excited about it, maybe some of what you do the first 2 or 3 times, or how you would introduce them to the location?
Gary was asking, what do we do when we have someone coming in to Project Independence but they're not excited about coming? And I'll be more blunt. They're furious about coming, or they refuse to get out of bed and refuse to get dressed for their wife, who's begging the gentleman to get up and get ready and go in. So one thing is that we say we try never to give up, because sometimes we just have to keep trying different strategies with the family. And so we'll try, in some cases, I or another social worker go to the home and do a number of home visits, and we'll bring cookie, and the next time we'll bring a brownie and get the person to like the individual, and then we'll say, now I want you to come to lunch and see where I work. So we might try to befriend the person over time and gradually get some cooperation.
When my husband started going there, you told me we needed him to volunteer. He was delighted.
Yes.
He thought he was volunteering.
Sometimes we get in cahoots with the husband or the wife or the son or the daughter, and we pretend that the person is a volunteer. And because some people won't come because it's a stigma in the person's eyes, and they don't want that loss of status. And in one case, we had to pay the person $5 a day for their work, and then the son would come to pick up his mother, and we'd give him the $5 back, and then he'd give it to us, and we'd give it to back, and so we just have to be creative. Now, sometimes it's just a matter of, we're always on the worst behavior with our own loved ones, and so often the family will say, we've been begging my father for 2 years to go to Project Independence rather than stay home in the same chair all day watching TV and getting dehydrated and ending up at the emergency room. And he keeps saying, no, I'm not going. And so then along comes a professional, whether it's the doctor or a social worker like me from Elderly Services. So at the doctor's office, or me doing a home visit, or some families will go for a ride to get an ice cream cone, and then, oh, Joanne or Amanda or Eileen over at Elderly Services wanted to meet you. I'm just going to drive up, and we've arranged that one of us is going to come out to the car. And then I get in the car and we'll sit there and talk to them for a while. And if an outsider says, you really need to try this 3 or 4 times for your son or your daughter. And I know you've been saying no, but sometimes you have to do something for your family, and this is the time. You really need to do this for your family, and we want you to try it 4 times. And I've been in touch with Dr. Huber, and he agrees, and sometimes that works. The person will say, well, I don't like it, but okay. Whereas they would never cooperate with a family member, they feel like that I have more authority than I really do. They just kind of give in a bit to a professional. So we have to try different approaches. But when the person, if we can get them in there for those 3 or 4 visits, then we assign someone one-on-one to try to help the person feel comfortable. And we have a seating plan. No one ever comes to a table and someone says, you can't sit here, I'm saving a seat. We have a seating plan, and we have what we call a guardian angel to be with the person all day, and we'll try to find out what their favorite foods are and see if we can have some of those. So sometimes we say we have to be like a used car salesman. We're trying to think of everything we can do to please the prospective person to get them to attend. You know, if you have to take your loved one to a nursing home, it's one difficult, miserable day, and then you turn around and you leave and you're upset. But if the person is really angry about coming to Project Independence, for some families they feel like, I got to go through this 3 times a week, this anger. So that's why we have these social workers, us and 2 others, that we have to help the family figure out how to cope and how to proceed. Go ahead.
You were talking about the $5 bill going back and forth. You have a very large operation. What are the funding streams for such an operation?
Mm-hmm. So what's the funding for elderly services? And so I had to remember, I said often when I ask, what do you hear about us? Someone says, I hear it costs a fortune to go there. So it does cost money. 80% of our income is earned income. So we get paid by the hour for the medical adult daycare center, and the full hourly fee is $25.76. That rate is set by the state of Vermont for the Vermont Medicaid program, and then the Veterans Administration matches that. And so 2/3 of the people who come don't pay anything because they're covered by payment programs of the Vermont Medicaid, which is low-income government health insurance, or they're covered by the Vermont Department of Aging Moderate Needs, which is a little bit higher income but still very modest, or they're covered by the VA, Veterans Administration. So then we have 1/3, and sometimes it's down to 1/4, but who are private pay, and some pay the full fee, and some we have a little financial aid application, so some people get a partial scholarship based on their income and their savings. We have a 1-page financial application. So we have a $2.5 million annual expenses. 80% of that is through these fees, and our counseling is either billing Medicare or people pay. And ESI College, the classes that some of you take, right now I think we're offering it just a contribution, no fee. And but then besides that, we belong to the school lunch program. So that, just like you have a child in school and you can fill out a form, and we earn about $60,000 a year to subsidize the cost of groceries. And we get a town meeting day grant from each town in Addison County. that might be $500 up to Middlebury gives $7,000 each year. And then we have fundraising donations of $200,000 to $300,000 a year. So it's a mix of billing and fees with fundraising, and then some grants. We get a United Way grant. Yeah.
Excuse me, do you take long-term care insurance that some people have?
Yes.
Okay, so you
Yeah.
don't have to be in a nursing home or be homebound for that?
Almost all long-term care insurance policies include payment for adult daycare and for home health agencies. So that's our biggest program, is this medical and social adult day program called Project Independence. But we also gave you a flyer just about counseling, coaching for older people, because I wanted you to be aware that we do have the ability now, because I'm devoting myself to social work, and we brought Amanda on. We always have provided counseling to the families of the people who are enrolled in Project Independence, and we've always provided some counseling to some of the people who belong to Project. And I always had a tiny little group of people from the community, but now we're trying to make more counseling and coaching kind of services available to older people in the community. So that flyer is addressing that we have this geriatric mental health or elder-oriented counseling program. And so it's for anything from, for some people it's just, I need to talk about my aging process with someone. I just thinking about my future, I find myself worrying what I'm going to do and where I should live. One person comes because he's trying to decide whether he should stay in his home or begin to think about moving into a residential care home or a retirement community. Sometimes a person comes in for counseling because a child lives in, say, Ohio and thinks mother and dad should move to Ohio, but they've lived in this area a long time. What are the pros and cons of relocating? So sometimes it's people coming to get some support, which I often call coaching, about just thinking about your life and what changes you're already dealing with or what might be coming down the pike for you. Sometimes it's that a husband and wife or two partners are just having new tension in their relationship, and sometimes it's related to retirement and they're together, you know, the classic picture that the two older people are together a lot more in the home than they used to be. But a lot of times it's also related to one person being in failing health and the other one beginning to feel like a caregiver and sometimes not really wanting to be that much of a caregiver, but feeling guilty about that feeling. And so the changing dynamic in a long-time relationship. Another person that I'm seeing has more to do with a new relationship, which is complicated because they both have two different sets of children and grandchildren, and how to work out this blended family when the new couple is in their 80s. And so there's tension about the roles of who's making decisions in this family, and trying to get the younger generations to like each other. And other people come simply because they've lost their spouse and they're grieving or lonely. And so it can be anything, but people in their 80s and 90s and 100 range are known to not have been that open to getting counseling. People in their 60s and 70s who are, that's where I am, 70s, baby boomers, are considered a little more familiar with or open to going to some counseling. So a lot of times, if we want to provide some counseling to someone who's isolated and 88 years old, we might begin by doing home visits. And as opposed to saying, come to counseling, we're just saying, oh, we're coming over for a little friendly visit, because the word counseling might be a no-no. So this whole counseling and coaching piece is a mix of people paying privately, because I'm thinking people are going to say, how much does it cost? At present, I bill Medicare if it's government Medicare, but our bookkeeper doesn't want to have to deal with about 30 different Medicare Advantage plans in Vermont, all with their special rules, and you have to belong to their network, and then they all have certification every 90 days to stay in their network. So the easiest thing for me when I see people is if they have government Medicare, it's an easy bill. Otherwise, we're trying to keep it affordable. So we have a fee of $65 for an hour or $90 for 90 minutes. And I know from our employees who go to counseling or have their children in counseling that they're paying $100 to $150 for an hour. That's actually 50 minutes. So our fee is actually almost only half of what you might be quoted somewhere else. So that's an important program that we're growing at Elderly Services. And we have a separate flyer, but I didn't want to give you too many pieces of paper, that is all about counseling for family caregivers, which a couple of people have mentioned here tonight. Specifically, 3 of us meet with people who are providing caregiving to a family member and feeling the stress of caregiving. So we meet with quite a few people about everything from how to take care of yourself, or how to introduce help to your loved one who's resisting help, and how to keep some boundaries on your own life so that you don't feel trapped. So there's lots of people in this area that are providing care to another person and feeling a bit trapped in the process. Any questions about that whole caregiving piece?
I just love the title, Positive Aging. And helping people look at aging.
Can't hear.
Positive fashion.
Mm-hmm. She said she likes the word positive aging. We have a whole talk on positive aging that is about recognizing all the negative attitudes towards aging in the United States and recognizing our own fears about aging and decline and death, and then deciding, do we all want to feel frightened and depressed, or do we want to feel that but also find a way to still enjoy our lives as much as possible? And so positive aging is about saying, despite my fear and despite my sadness and despite the losses that I've suffered, I want to figure out a way to enjoy the time I have left, and I want to think through how to do that. I mentioned the idea of figuring out how much structure you need in your life. Some people's structure is to be home doing chores. They grew up, my husband, who's 75, grew up on a farm, and for him, structure is he's got a list every day of outdoor work that has to be done, and then he has a meal at 2 o'clock, and he doesn't really want to see people every day because he grew up in the Midwest, and the closest neighbor was 2 miles away. So he's used to being alone and likes it, but he likes that structure of having work and chores and responsibility. And for other people, it's that they like to get out of the house and go have some event every day, whether it's a gym or going to visit a friend, taking a walk with a friend. But one idea in positive psychology is to have some structure in your life. And another one that we stress a lot is learning to notice every positive thing that happens to you during the day, because psychologists have proven that we really notice negative things and hurtful things, and we let them stay with us and think about them again, about why someone said that to me, or I wish I hadn't said that, or that person let that door fly right in my face, or I fell and I was so embarrassed. But if we could begin to notice small things or remember the big things in your life. So every night I write down religiously 10 things in a notebook that I'm grateful for that day. And it might be the delicious muffin I ate at 1 o'clock. It might be a small thing like that. It might be Amanda's back from her vacation, so a good thing at work. It might be a big thing like 45 years with my husband and I love him. So that's a big thing. But to remind yourself of anything positive about your day, it might just be my eyes are still working, or I could take a walk for a quarter mile today. So in counseling at Elderly Services, we try to work with people on, let's look at the 6 gospels of positive psychology, and let's practice some homework for you to try to see if you take on some of these things, if it makes your mood feel better at all. But the one about structure leads to, that's why a lot of people come to Project Independence, because that structure in their week gives them a reason to get up in the morning, put on good clothes, get nice and clean, brush their teeth, and they like that structure once they get over resisting it. And some people like the structure of going to our classes, our lifelong learning classes, ESI College. And so there was one today and there's one tomorrow. And those are classes that I think, how many of you have taken something at ESI College? So, okay, maybe 8 people or so. That's classes that might be taught by a Middlebury College professor. The professor that's going to talk to you next month about the election often has done a class for ESI College about politics or the elections. And sometimes we have retired high school teachers, and we used to hold them right in our building, but we're having a lot of work done on our building, so we're holding our classes in the Middlebury Congregational Church right now. And as I said, if you want to see what those classes are, we have a huge group email that we need your email to put you on that list. And I wanted the last thing I wanted to mention about Elderly Services is that we have many volunteers, and most of them are older people, retired people, and a lot of them will say, I like the structure of my week. So we have a man who's a retired doctor, and he volunteers for 3 hours, 2 to 5, every Friday. And the beauty of being a volunteer is that if something else better comes along, he just calls up and says, it turns out I'm going on a trip for the day with my sister. So you have the beauty of canceling whenever you want. But we have some elderly volunteers who just say, is there anyone that would like, I could play cribbage, or I could play cards with someone. I could come in for an hour twice a week if there's anyone that would like to play Scrabble or any kind of game like that, Rummy Cube, because we do have people who want to play a particular game, and they're always looking for someone who can play that game with them. So if anyone is looking for a volunteer opportunity, you can keep that in mind, and keep in mind the counseling and the coaching and the classes. And I want to hear any questions now, and then let you get back to your own meeting. Questions or comments. And remember that we tried to include all kinds of other services in Addison County on the piece of paper that you can take home. But how about any questions or thoughts you'd like to bring up?
Announcement for the elderly services, what are they, courses or whatever you do, is also in the Addison Independent.
Okay, yes. On the editorial page, I think we always put an ad
There's always an ad.
for a few weeks with the classes on.
Probably on your website too?
And it's on our website, which is elderlyservices.org.
Okay, I have a question. Age well is often, brought up. How do you interact with them and
Yeah,
coordinate?
so we're close friends with another agency. It used to be Champlain Valley Agency on Aging, and they changed their name to Age Well. So we talk to them pretty much every day about something, some people, or coordinating in some way. So Age Well is a bit different. Age Well is an agency that the federal government has created an agency on aging every single place in the United States. So there are 5 in Vermont, but every area of the United States has to be served by one of these agencies on aging. So our Age Well serves Addison, Chittenden, Franklin, and Grand Isle counties. And they're the provider of a big federal program called Meals on Wheels, which I'm sure most of you have heard of. So Age Well, a huge part of their operation is providing Meals on Wheels in those 4 counties. And the federal government also requires them to offer a 1-800 senior citizen information line. So Age Well has a 1-800 number that you can call and ask for information about where are the elderly housing complexes in Grand Isle County or in Addison County. Or you can ask, where can I get my taxes done by a volunteer in Addison County? Some people call Elderly Services with questions like that, and sometimes we know the answers to some of them, and sometimes we say, call this number, 1-800, we know the number by heart, and then tell you to call for more information there. And Age Well, the federal government requires Age Well to do Medicare counseling. So they help people sign up for Medicare. They have 2 employees that are specialists in Medicare, and they help you decide if you're going to get government Medicare or take a private company's version of Medicare Advantage. And they help you pick a Medicare supplement if you have government Medicare, and they help you pick a Medicare drug plan if you want a Medicare drug plan. So that's another thing. The United States government says everywhere in the United States has to have Meals on Wheels, Medicare counseling, an information line, and in the last 5 to 10 years, some exercise classes. So the federal government gives funding to offer Tai Chi, and bone builders are the most common. But if you called Age Well, they could say that in Addison County, bone builders is offered these 4 locations at these times, and Tai Chi is in these 3 locations. So, and the final thing that the federal government mandates is that a place like Age Well is supposed to have senior dining sites. So that got messed up with during the COVID close downs. It all became takeout meals, but now Age Well is getting back to offering some group dining sites in Virgins, you know, it was at St. Peter's Catholic Church, and that's a contribution. So those are federally funded meals for elders. If you're not homebound getting Meals on Wheels, you might go to a congregate meal site, or they call it senior dining. So that's what Age Well does. And some of the people that come to Project Independence are also involved with Age Well. So we coordinate with the staff of Age Well. We set up Meals on Wheels for people on the days they don't come to Project and things like that. Mm-hmm.
Is there also an elder ombudsman in the county or in the area?
There's an ombudsman, which means a receiver of complaints. There's a long-term care ombudsman, and I believe the person works under the Office of Vermont Legal Aid, but funded by the federal government for people who receive long-term care services. So if you're in Helen Porter or you're in elderly services, and maybe if you're at Shad Villa or a residential care home and you want to file an official complaint about the place that's serving you, you can file a complaint with that ombudsman.
Just as a point of interest, we've had a relationship that occurred where the ombudsman was walking through the halls of a nursing home and just made random decisions as to who might need an ombudsman without conferring with any family member.
Oh.
And we were the, what would we be? We were the trustees, I don't know. Yeah, we had the attorney, that's the word I want. You have a document that says you go to medical power of attorney, that's it, yeah.
Oh.
And then all of a sudden, we got this, phone call from someone stating that they were going to be the ombudsman for our relative. We're like, well, no, you're not. So it works in a different way than what we thought it should work.
Yeah, that sounds intimidating.
It was hard to work through.
Yeah.
You might not want to answer this, but somebody told me today that the program that you've had such a role in establishing here with elderly services is so highly regarded nationally that a number of places have tried to recruit you to come and set it up in their states. I'm just wondering if that was true. I heard that today.
True in my younger years, not true recently. Yeah. But so whenever you succeed at something, other people think, oh, maybe that person would like to relocate. But my heart was all in with elderly services. So.
Haven't you served as a model, though, for other care centers as sort of a demonstration center?
Yeah, we were very lucky. That was a long time ago, but we entered a competition and became a national model under the Robert Wood Johnson Foundation, and they sent people here to be trained, and that was a very good experience for all of our staff. Nice compliment. Okay. Oh.
I guess what's the ratio of people caring in a Project Independence and the number of people who come as guests?
So the ratio that we have is 1 employee for every 4 participants, but we try to have volunteers there as well so that there can be more attention given to people. The state requires 1 to 7, but the regulations say if you have people with high needs, you should consider going with a more intensive ratio. So we've been operating at 1 to 4 for a long time. Mhm. And
Do you ever do a short-term thing, so if my mom had a need and I needed to, be at work, be away, whatever, and I just needed 1 week stay, where they would be here for the week? Is that possible, or is it only a long-term?
no, this was, do we ever do short-term? Yes, we do. So some people just come when they're recovering from a knee surgery, and sometimes it's not that they're unsafe at home, but they're not moving around enough to get water, living alone, moving around enough to get enough water and good food, and getting lonely and bored. So it's pretty common that we've had people come for 1 week to 4 weeks to recuperate after a knee surgery, and then they're back to driving, and so they graduate. But what's more common is that someone from this area brings their parent up for a week or 2 weeks vacation. Just maybe the mother or father lives in Connecticut with the brother, but he wants to go away, so the sister's up here and brings one or both parents up and asks if we can take care of them during the day for 1 or 2 weeks while she goes to work. We still have to do all of our enrollment paperwork, which takes a couple of hours. That's no big deal, but so we've done a fair amount of that. Mm-hmm.
Do you collaborate at all with Addison County Home Health and Hospice?
Yes, that's another good friend agency that we're in continual contact with. So you can imagine our 100 people that belong to Project Independence, many of them have visiting nurses aides, visiting physical therapists, and so we have social workers at Home Health that we're in contact with about our mutual clients, and if one of our people goes in the hospital, we try to notify Home Health and vice versa. And sometimes the Home Health nurse or physical therapist or social workers actually will come right into our building to see their patients if it's a quick visit and they just want to lay eyes on the person or pick up something that the daughter is sending in with mother. And so, yeah, there's a close relationship there.
You visited a friend that I had referred, and one of the difficulties was there was this person who did not have any family members. And I think you had mentioned that there has to be family involved in order to make this whole thing work. So for individuals who do not have a family connection and who are failing and having difficulty making decisions, what's the best avenue for them?
When I say there has to be a family member involved, depends. There are people that we take care of who have no family member involved, and there is no family, but they live in relatively clean living situation, and to be in a group program like ours, people close to each other, you have to be well-groomed and clean. We have, if not, we get people complaining about body odor and hygiene, and so you have to, we don't really deal with people who are living in cars, so we're pretty clear with the homeless agencies that people living outdoors on Medicaid or in automobiles on Medicaid, or in a building with no toilet and no shower and looking very dirty or unkempt, and having medical issues, but nobody, so complex, but nobody that we can turn to, that there are situations that we just say to age, well, this doesn't seem like a good fit for us. It doesn't seem like a good fit for the other people in the program. And then there are others who live alone and they're 101 years old, and the family is all out of state, but we're on the phone with the family all the time, and they're paying for help to keep the person clean, and so it's not a black and white thing that there has to be family. In your case, there were many factors that were problems.
What would a day at Project Independence look like?
What would a day at Project Independence look like? As I said, we open at 7, so the first family might bring someone in at 7:15 or 7:30, and so it's like a little coffee shop until about 9 or 9:30. At 7:30, we have 4 or so vans going out to different parts of the county, down to Brandon, up to Ferrisburg and Virgins, and up to Bristol, and down to Shoreham, Cornwall area. So if you're one of the first arrivals, you're having coffee or hot chocolate. We have yogurt and fruit. We have toast, cereal if you want it. We don't have bacon and eggs and that kind of thing. But so people are reading the newspaper, visiting with the staff that are in early, and some people have something to eat, and the family might say, Dad's been up since 5:30. So some of them people, after having a little bit to eat, by 8:30 might be saying, can I lay down? We have recliners in different rooms. At 9 o'clock, big numbers of people start arriving on our vans, and then we begin having, it's a busy dining room atmosphere, and then we start having programming with choices of, you can go to a group called Morning Headlines or Morning Word Game. That's 9:30 to 10, and then at 10 o'clock there's a morning meeting, chat, or an outdoor walk, and then at 10:30 there might be a Jeopardy game in one place in the building, and there might be a live music band playing somewhere else in the building, and some people are playing a game of rummy, and some people are doing adult coloring. So we have about 20 different rooms, so people are spread out, and nurses and staff are helping certain people to the bathroom on the sides quietly. We have 9 bathrooms, and then at 11:30 we have a walk again outside, and another stretching to music. Then we have a big dinner, noon to 1, and then we repeat another entertainment period with choices. Could be a field trip to Dead Creek, and a game of Wheel of Fortune, and a game of outdoor golf or indoor golf. There's usually a sport game offered at every period. So when I say it's like a school or a summer camp, there's an activities program posted through the whole day, right up till supper time, and 2 or 3 things to choose from. And some of them are outside, some are in, and usually one is a physical game of some sort, whether it's indoor basketball, pool, golf, shuffleboard, and all of those sports are adapted to people that are 80 to 100 years old, and with staff help so that they can play the game safely. Someone might be holding on to you while you're shooting the basket. Then we have a supper, and then we have an after supper word game, and the final van is leaving at 6:30 at night. So, yeah. Okay, I think I have to end right here because I think you have more to your meeting, but thank you all for coming.